A heart attack can be life-threatening to anyone, but it's especially dangerous for women because the symptoms appear differently. Well, now a new study suggests the gender of the medical provider who treats a woman having a heart attack may mean that difference between life and death. Joining me today for Real Talk, Kara Kinnear, author Amy Lau, and making her Real Talk debut, family nurse practitioner Julia Eze. Welcome. So, our fabulous producer, Haley, thought this was going to be very topical because 2 weeks ago, I know these two know, but I was having horrible chest pains after a show.
Wow.
I know I'm healthy, but then I started getting tingling in my fingers. Long story short, went to the ER. Not just went to the ER, actually took an ambulance. So anyway, I thought it was that bad. Turns out it was something else, have like inflammation. But I will tell you, and this is maybe going to get into the male-female thing, my husband, I'm not saying he's not empathetic, but he was just like, seriously? Like, he doesn't believe you go into the ER unless I think you're bleeding out. And again, I think in his mind, he was like, you were fine, you were healthy, it wasn't a heart attack. So I thought, well, let's dive into this, especially now with this study, because the research is saying that matching females with females in the ER, they're gonna give a woman almost a 6% better chance of survival. Experts think it's because female physicians communicate more clearly. They may be more in tune with some of the unusual heart attack symptoms. And so I'm going to start with you, Julia. What do you think about that? What do you see on a daily basis?
I think on a day-to-day basis, really when patients come in, there are lots of factors at hand. And sometimes the symptoms just aren't clear-cut. You know, when you go in, you know, you may have other comorbidities or chronic conditions that really may make it harder to identify what's actually happening with you. You know, because really, if you think about it, if you're, you know, have the risk or the potential to have a heart attack, you probably have a lot of different factors at play as well.
Sure, sure. And do you feel like, or either one of you, I mean, well, your husband's a physician. I mean,
he is heartless.
Do you feel like
he's the best?
He's the best. That this, you know, I mean, it kind of makes sense in general, feeling like you have that a female's empathy, or I mean, I just think, you know, are we kind of reading into this a little too much, or do you feel like this might be a play? What do you think, Kara?
Well, I similarly have heard, I had two female OBGYNs that delivered both my sons, but I had a woman say to me that a male doctor is actually much better in the birthing process because they're so like, what's going on? Like, they're more, like, they don't understand, so they're more like sympathetic. Sure. This is what I've heard. And that the woman is like, we all had to do this, like, let's have the baby. I don't know if that's true, but that's what a woman who said had a male OBGYN said he was much more coddling to her, and the woman was not.
And I think it can go either way.
Yeah.
You know, if I'm talking to a female physician about pain, I can liken that to that of menstrual cramps or the birthing process, and really feel that she understands and really can relate to what's happening. Whereas if I'm, you know, having that same conversation with a male physician, while he may understand the clinical process, the relatability piece might not be there.
Might be lacking.
Yeah, I think it could go either way.
Okay,
definitely.
What do you think, Amy?
I think it's all about perception. So let's take something more personal, like Kara was talking about, like your OBGYNs. They're all up in your business. And so one time I had an OBGYN that was telling me about his new golf club, a Big Bertha. And he was going on and on and on. Well, I'm naked. And so I was like, you need to wrap things up. Like, I know you see people naked every day, but I'm not naked in front of men every day, and and I'm getting anxiety. Like, he's like, oh my goodness, I am so sorry.
Oh, he was probably just trying to take your mind
But
totally
if it was
off
a woman,
of it.
if it was a female, and she was telling me about her new tennis racket, I'd be like, what? You know, I wouldn't. And so I think, but I would never make the. I would never make the jump to say that female is a better doctor than the male doctor. I don't think that. I think it's just we are more sensitive to things as a female, and just like if you're a male, would you want to have your prostate checked out by a female? I would want somebody that has the same equipment. But that's just me personally, it's a preference.
Right, and I totally get that and understand, and you're absolutely right, because I have had male OBGs and OBGYN and females, and I think that the males are just trying to make conversation and, you know, take your mind off of what's happening. In your case, it was like a little too long. But this study was saying that male doctors take longer to diagnose and thus treat heart attacks because the symptoms are harder to recognize, a little bit more about what you were saying. So let's back it up a minute, because I think the reason I got so scared is because I have interviewed these incredible physicians in our city that made me aware that the symptoms of a heart attack for a woman are different from the symptoms of a man.
Right.
So I started thinking, is it a heart attack? Oh my God, is it a stroke? And so I panicked. So there are different symptoms,
yes,
correct?
there are different symptoms. So traditionally, I think people assign chest pain and shortness of breath to heart attack. However, for women, these symptoms can be very different and can include but aren't limited to sudden onset of weakness, anxiety, sleep disorders, pain in the arm, neck, jaw. You know, so these things are very, unusual.
Yes.
And also the symptoms of a lot of other things besides a heart attack.
Right.
So if
Exactly.
you're listening to someone
Exactly.
saying like they can't sleep and they have an anxiety, it's like, oh, you're stressed. Like
Right.
it would not maybe your go-to.
Exactly. You'd assign it to something else more
Right.
likely.
Well, we're
Interesting.
quickly, I just want to go to the poll because we asked you before the show end on Facebook, do you prefer, ladies, a female doctor? And let's see what our poll says. Yes, so far, female docs get me. 83% overwhelming. And then no, well, gosh, if it was those two, I would say, goodness gracious, Trent, thank you for that, Trentster. I would say, no, it doesn't matter to me, but I think there is something to be said for it being relatable in that regard. Now, it also found that both male and female patients experience similar outcomes when treated by a woman. Is that surprising?
Not to me. I mean, when you think about it, women have historically been nurturers and caregivers. So for men and women to feel more comfortable, per se, or reap the benefits of seeing a female physician, I don't find that surprising at all.
Yeah, and Kara, kind of getting back to what you were saying, or getting back to just like the male. You've told me before that you feel like you have to be practically on your deathbed before Lee pays attention. I mean, not, and again, I'm not trying to bash, but like Jim, I could tell when he rolled up and he looked at me and he didn't roll his eyes because I was literally like dumb. But he was like, "You're like the healthiest person I can't." And we just got the bill, so.
I mean,
it was expensive.
That is
I was scared.
spouse thing too, right? Like you just want to make sure that because they know us the best, so they're like, "Are you overreacting?" And you were not.
I'm the Jim and the Lee in my marriage, though, because my like when my daughter was little, I would say she's fine, and then she ended up having RSV, and I just because I was never taken to the doctor. It's like you're fine,
healthy.
you're fine.
Right.
And so sometimes that's not male or female. It's just your personality.
Right, and that's it's the way you were brought up.
Yes.
Or, again, knock on wood, we've all been healthy. So Jim's like, I just upped our deductibles because we're also healthy, lacking heart condition. It's gonna be fine though. I was like, thanks, Jim.
And that's half of the medical class is women.
Yes.
And I was reading this article about, so half of the women are coming out. People want women, especially in an OBGYN situation. And what happens is those women get so busy, then you're going to see the same things happen in a very busy practice with a man, and they spend less time with you. So regardless if you're a woman or a man, it's like you cannot fight how insurance is changing, how they're like hustle.
I know.
And so that's part of the system, unfortunately, regardless if you're a woman or a man.
But I think, a good point to make is that from an advocacy standpoint, patients can really, or just everyone can start really accounting their symptoms. If you know that you've started experiencing something new, write it down. Keep a journal.
Patient portals now.
Exactly.
I want you to utilize that patient portal.
Because that's going to help you be able to better advocate and speak for yourself. And to say, X, Y, and Z has been going on, and it happens when I do this, or I notice it when I do that. And that can better, eliminate maybe running around in circles and get to the point, help the doctor who may be short on time
or your family
better
history.
address. Exactly.
Family history.
Have your notes in your phone, wherever, and say, actually, I've been feeling this way for a week. Okay, quickly, how hard would you push back, Kara, if you're hearing like, no, but you know your body, we know our bodies?
Well, I think that's obviously like the patient, you are your best advocate, right? So if you feel like something is wrong, and I do think that as women, we have strong intuition to listen to it, make sure you get it checked out, get multiple opinions.
Yes.
And any good physician will tell you to get multiple opinions. If you are not happy with the diagnosis that you get, or you feel like something's off, if you have a good doctor, they will say, get this checked out by somebody else then. I want you to have as many opinions as possible.
Yes, Amy, we got to wrap it. What do you feel the
I
same
think
way?
you need to go with who you're really, really comfortable with, and that may be a man, that may be a woman.
Right, but at the end of the day, do you feel like maybe you
I
have
feel for my
experience
lady
or-
parts, I would like a lady.
Yeah,
I'm kind of open-minded on other stuff.
Okay, right. Of mine, other not that. And Julia, lastly, what do you think?
Lastly, I think we really shouldn't focus on whether we get a male or female doctor, but more so look for ways to incorporate a healthy lifestyle. The American Heart Association recommends 30 minutes of moderate to vigorous activity, 5 days a
Good
week
reminder.
to really decrease your chance of cardiovascular disease. And we know that women have the highest mortality for cardiovascular disease. So I think that's the big takeaway.
Yes, I love having this. Is so good. We got to take care of ourselves, but also know your body. And we just so appreciate your expertise and you guys weighing in. We'd love for you to continue to weigh in on our poll. And